if you have a low-grade ACL tear, that you need not to go for surgery. We can heal it with platelet-rich plasma injection.
After the 3 to 4 weeks of session, they are feeling light. They are feeling far better than they were feeling before, along with the PRP they have taken.
हेलो दोस्तों, आज हमारे साथ थ्रेड्स फिजियो के एक्सपर्ट फिजियोथेरेपिस्ट आयुषी शर्मा मौजूद हैं। कुछ सवाल करेंगे हम इनसे ACL इंजरीज और ट्रीटमेंट के बारे में। तो आयुषी, आप बहुत सारे ACL के पेशेंट्स देखते हैं, आप मुझे ये बताइए कि ACL इंजरी के बाद जो ब्रेसेस या सपोर्ट या वॉकिंग एड्स लगते हैं उसकी कितनी ज़रूरत रहती है और क्या वो लगाना चाहिए, नहीं लगाना चाहिए?
यूजुअली आई हैव सीन पीपल जो आते हैं पेशेंट्स, वो ये प्रेफर करते हैं कि उनको अपने आप को एक कंफर्ट जोन में रखना होता है, बिकॉज दे गॉट इंजर्ड, सो दे थॉट दैट कि अगर वो चलेंगे तो वो गिर जाएंगे या वो कंफर्टेबली लोड नहीं ले पाएंगे, या काइंड ऑफ प्रोटेक्शन, लाइक दे वांट देमसेल्व्स इन अ लग्जरियस कुकून टू सेव देमसेल्फ कि और इंजरी ना हो जाए। बट एज ऑफ आई हैव सीन द पेशेंट्स, मैक्सिमम पेशेंट दे डोंट रिक्वायर द ब्रेस आफ्टर एन ACL tear, because if you keep the knee inside the brace, then if you won't bend your knee or if you won't straighten up your knee correctly, then it will gonna harm you as well.
So what do you feel that after the injury the patient should use some kind of braces, or they have to use for some days and then they can remove it? Is there any difference of braces?
Yeah, there is a type of braces that they can prefer, kind of hinge knee brace, range of motion brace, long knee brace. So depends patient to patient. If the patient is complaining or having a fear of buckling, so we usually advise patients to wear brace for a short period of time, kind like 3 days or 1 week, so that patient will get comfortable with the movement, or patient will get comfortable with the injury, and then we explain them, then now you can wean off the brace and you can start with the strengthening or basic loading of your knee.
So what I can understand is that when a patient get injured and he thinks that is an ACL injury, or he goes to an orthopedic surgeon, they do one MRI and MRI shows the ACL tear, then he can wear some kind of hinge knee brace so that he can have some kind of protection for few days, 3 or 4 days. If he can manage without the brace, then can he walk without the brace?
Yeah, he can walk without the brace. Usually maximum people are the quad dominant people. So we believe in the progressive loading. So we start with the basic statics or quadriceps loading exercises, so that patient get rid of their fear and they can start bearing weight with the strength and start walking slow normally.
Is there any difference if the patient comes with you with an MRI report that they have one ACL tear, and what are the other injuries, meniscus tear or maybe the MCL tear, which you feel that they need the brace or they don't need the brace?
In that case, if patient is complaining of meniscus along with the another ligament, including with the ACL, so we usually advise to wear the brace during the traveling and sleeping most common.
But mostly it is advisable that one should remove the brace as soon as possible and start doing the exercises. What is the harm if the patient continues using the brace for 1 month or 2 months?
It is like the muscle will go into the wasting and the patient won't be able to take the load properly, and most important, the lacking of confidence the patient feel. Patient will get dependent to the brace and won't able to gain the normal strength of the muscle.
Is there any harm if they continue brace for 1.5 months? Because we also see a lot of patients with the ACL injury and most of the doctors tell them, okay, you need the brace for 1.5 months or maybe 1 month. What is the harm of using the braces for such a long time?
So usually I have seen the people, they get depend on the brace, and when we make them walk, they get scared. And usually they won't be able to adapt the normal range of motion or normal movement of the knee. So I would like to know about that. What are the basic or common causes of the ACL injury?
So if you ask, in my practice, the most common cause of ACL injury is lack of exercises. Most of the patient who comes to me with an ACL injury, either they are very high-end professional players, so obviously the sports plays a big role. If you are playing kabaddi and if you are playing wrestling, इसमें बहुत ज़्यादा ACL टूटते हैं लोगों के। पर अगर कोई प्लेयर अच्छी टेक्निक के साथ प्ले कर रहा है, उसके कोचेज अच्छे हैं, साथ में वो ACL प्रिवेंशन एक्सरसाइजेज भी रेगुलरली कर रहा है, फ्रॉम द बिगिनिंग ऑफ देयर करियर उसने इतनी स्ट्रेंथ डेवलप कर रखी है एक अच्छे फिजियोथेरेपिस्ट के अंडर गाइडेंस में, then the chances of ACL tear is very less. Second, there are so many common people who comes to me with the ACL tear. बाइक से गिर गए, फिसले गिर गए, रनिंग करते हुए गिर गए। ओकेजनल जो लोग प्ले करते हैं उनके बहुत ACL टूट रहे हैं। ऐसे रोज प्ले नहीं करेंगे, पे एक दिन क्रिकेट खेलेंगे, एक दिन फुटबॉल खेलेंगे, वीक में एक दिन। द मोस्ट कॉमन चीज जो उन सबके अंदर है वो है nobody or very less people are doing ACL prevention exercises. So if somebody is doing ACL prevention exercises, no matter what kind of game you are playing, whether you are an occasional player or you are a professional player, आप अगर कोई भी तरह की एक्टिविटी करते हो जिसमें आपके नी को इंजर होने के चांसेस हैं, चाहे वो वीक में एक बार हो या साल में एक बार हो, आपको अपने ACL prevention या knee prevention exercises करनी ही करनी है. So if somebody is not doing it, that is the single most cause of ACL tear in our country.
So as you mentioned that common people are having like with an accident or doing an activities, people are having ACL tear more,
Right.
including the athletes. So is there is any other method of treating ACL injury without going for a surgery?
Definitely, these days the regenerative medicine is coming on a very fast pace everywhere around the world. So if the ACL tear is low grade or there is ACL edema and if the patient comes to us quite early, then we can heal the ACL and heal the meniscus or MCL or LCL or PCL. If the tear is less, if it is a low grade, if it is a edema, then we can heal it with the help of their own blood. It is known as PRP or ACB platelet rich plasma. So what we do, we take out the blood of the patient, we separate out the plasma and platelets from the blood and then we re-inject it into the knee. As you always know, then whenever there is a cut in the skin, you get this blood clot banta hai. Then you get the new skin after some days. Why? Because we have platelets and growth factors in the blood which regenerates the skin and every tissue in the body. But unfortunately the knee doesn't have so good blood supply. It is filled with the synovial fluid, so that's why the repair is bit less. It is always advisable that if you have a low grade ACL tear that you need not to go for a surgery. We can heal it with platelet rich plasma injection, but it only works if somebody is doing regular exercises for 6 months after the injury. If they are not doing it, then the chances of healing becomes very less.
Alright, I've seen like still now people are not much aware of the PRPs and ACPs is the new thing like as of nowadays. Why are you still preferring PRP rather than going for a steroid or gel injection?
So there are 3 kind of injections in the knee which a normal orthopedic surgeon will prefer. One is gel, second is steroid and third is the PRP. So when we talk about the injury, we need healing. So when we need healing, there is no point of some kind of chemical substance which doesn't induce healing. So then only PRP will be effective because PRP has platelets and growth factor which will induce the healing. Gel is for the older patient who has the knee osteoarthritis. So what it does, it is a high molecular weight substance. When we inject in the knee, it lubricates the knee for about 1 year and it reduces the pain. Steroid function as to reduce the inflammation in the knee. So that is also useful in older age group with osteoarthritis. So Ayushi, why it is necessary or you feel is it necessary that after the PRP treatment for an ACL tear, the patient should do exercises and for how many months? And is it important to do exercises or the body can heal without the exercise as well?
Alright, so patients are having mentality that they get an injection and now some magic will gonna happen inside the knee or the wherever they are taking the PRP and they'll gonna be fine. After a few days, they are not doing anything, no exercises, and they usually complain that we are feeling light, but we are not completely feeling light. So PRP will gonna work if you're gonna do the exercises together along with the PRP treatment. If you won't follow the exercises along with the PRP treatment, then you won't get the proper benefit as you'll gonna get along with the exercise treatment, because exercises will gonna help you out to increase the strength and PRP will gonna work as a catalyst to growth and to help you out to strength on your knee.
Means what kind of exercises, for how many months they have to do the exercises?
If it is about the month, so after the PRP you should follow the set of exercises at least for 4 to 6 months to go back to the daily life or to go back to the sports or your normal routine.
And what do you feel that when a patient comes to you after the PRP treatment and you are teaching them what exercises they need to do, what is the optimum time period when they feel good, when they will have no problem in their daily living or when they can able to run?
As per the patient comes here, so we have seen the patient, they said that after the 3 to 4 weeks of session, they are feeling light, they are feeling far better than they were feeling before along with the PRP they have taken.
So basically 3 to 4 weeks is the time period when they will feel good.
If they follow the proper set of exercises. If they follow the proper exercises,
then they will feel good, they will feel that they are healed within 3 to 4 weeks. But then why you are telling that they have to do exercise for 3 to 4 months?
If you leave something in mid, then you're gonna face the same kind of problem again, because the thing you started, you have to complete it properly to get strengthen your knee. For example, if you have taken PRP for the knee that you are having complaining, most common people are complaining of knocking knee sound. It's like that people are preferring, they usually say that कि 3 to 4 weeks के बाद अब हमारा sound कम हो गया है, अब हम exercises नहीं करेंगे. After 2 weeks, they again come to to us and they are like, again we are having the same kind of problem and it started again. So if you're gonna leave something in between, then it won't recover properly. So if you want to get recovered, then you have to follow the proper routine or proper program of exercises to get rid of the problem completely.
Is this also a case that if somebody leaves the exercises after 3 to 4 weeks after a PRP treatment for partial ACL tear, is there a chance that they can re-injure themselves?
Yeah, for sure they can. If they leave the thing in between, their muscles started going in weakness again. Again, they are feeling the same kind of problem. Like people are like, I'm having problem in this. Usually they said they are having problem in prolonged standing, prolonged sitting, prolonged walking. After taking exercises along with the PRP, they said that they are having less problem they were getting initially, and then they left doing the exercises. After few time when they left the exercises, they are like, we are again having the same kind of problem because they stopped the exercises in between. So the thing they initiated or they started working, they did not complete this properly. Alright, as we go for the ACL reconstruction, so there is a new term in which is just hiking up bio-ACL reconstruction. So sir, I would like to know what is the difference between the bio-ACL reconstruction and the ACL reconstruction?
So basically, when we say reconstruction, we are making a new ACL with the tendon, either hamstring tendon or quadriceps or peroneus longus. Now, when I am saying ACL repairs, then I am repairing the injured ACL. Sometimes what we observe that the people come quite late to us, and if the injury is bit higher and the total repair is not possible, then we do repair plus reconstruction. So if I feel that my ACL repair is not that strong, to give a patient a very good result, because most of the fibers are torn, but only 20 or 30 or maybe 50% of fibers are there, and I am able to repair only 50% of fibers. Then I will make a new ACL and then I will repair the old ACL fibers with it. So it's known as bio-ACL. Why bio-ACL? Because that's how we have preserved the nerve endings and the blood vessels of the original ACL. So the ligamentization will be of better quality, it will be bit faster, and the complication of graft, like graft failure, graft loosening, the chances of complication are a bit less in bio-ACL. And the patient will feel much more confident from the day one because they have the proprioception nerve endings and the blood vessels. So everything around the knee which we are doing is about harming the patient a bit less. Because surgery itself causes morbidity, surgery itself causes harm. So the less the harm I give to the patient during the surgery, better the result I will get. So I will prefer to do ACL repair on the first place. If ACL repair is not possible, then bio-ACL means ACL repair and reconstruction. And if it is not possible to repair any fibers of the ACL, then only the ACL reconstruction. And also in ACL reconstruction, we do ACL reconstruction with internal brace, so the bones holes are very less. We are giving a support of fiber tape over the ACL so that rehabilitation goes at a faster pace and the patient gets the better results. So Ayushi, tell me one thing, why you have started healing ACL patients? What is the reason that you are in Threads Physio? What is the reason that you started your practice as a sports injury expert physiotherapist?
As I am from an Air Force background, so I lived in an army area and I've seen a lot of people, they started running with the sandbags. They're having most common issues like I am having knee problem, when I run, I'm unable to run with the weights and all. So I grew up like this. I was so much interested into the sports, and when I was in my college days, I used to play badminton and a lot. Then I've seen people are having a lot of problem which is only related to the sports only. Then I've decided that I wanted to do something related to sports, and I am so much interested into cricket as well. So I just wanted to work along with the sports people, and I want to see what are the common problems they are having, what they are avoiding, what they should avoid, what they are not doing, or exactly what they are doing to just get rid of the problem. So that here I am in the Thread Physio to help you out, to help everyone so that they can get over from the problems they are actually doing or the thing they should actually avoid.
So does this make you happy when you treat all of these injured patients?
Yeah, obviously it makes me very happy. It's like I feel like that usually there is a quote people say that physios are having the healing hand without harming anything. So this is what I do feel, that I want to heal the people without doing any kind of harm to them.
ऑर्थो स्पोर्ट्स इंजरी के साथ भी, इंजरी के बाद भी